All right, I see we have a good number of people joined now, so we can get started. Let me welcome everyone to the webinar. My name is Edward Kataika, and I'm Director of Programs at the ECSA Health Community. This webinar is the first in a series that we'll be organizing for the ECSA Health Economics Community of Practice through the support of the Tanzila program. The ECSA Health Economics Community of Practice was established about 2 years ago as a platform that provides an opportunity to participants with economics or related backgrounds from the 9 ECSA member countries to interact and exchange knowledge, ideas, and experiences on health economics related policies. We see this as a mechanism for the participants who are mainly drawn from ministries of health and select academic institutions of the member countries to continuously learn together and from each other. The platform also allows for interaction between the health economists from our region and their peers from other regions on the continent and beyond. Since the establishment of the community of practice, we have held 2 face-to-face meetings, which included lectures on some health economics topics of policy relevance to our region. We also had a webinar during the launch of the Global Health Economics Hub on the Global Health Network. It is our intention to continue with this knowledge sharing process within the community of practice, and we will be doing this through the webinar series. As you'll have seen from the announcement, today's topic is on intersectoral resource allocation. Our ministers of health in the ECSA health community have on a number of occasions deliberated on and passed resolutions addressing social determinants of health and the need for intersectoral action towards improving population health in the region. So the topic for our webinar today is very relevant, and I believe will provide insights to issues that are high on the policy agenda for the region. Let me now introduce our speakers for today. We have 3 of them. First, we have Professor Susan Griffin from the Center for Health Economics, University of York in the UK. And the University of York is our partner in furthering health economics in the region. So Professor Susan Griffin will give us a talk on the economic methods to inform intersectoral policies. We also have Dr. Aloysius Senyonjo from Makerere University School of Public Health, and this is in Uganda. Aloysius will give us a talk on the policy demands for intersectoral actions to meet health challenges in Uganda. We will also have Mr. Stephen Banda, the Director of Policy and Planning in the Ministry of Health and Child Care in Zimbabwe, who will give a commentary on intersectoral resource allocation from a policy perspective. And Stephen Banda is a member of the Health Economics Community of Practice as well. This will be followed by a question and answer session and general discussion, time permitting, and this will be moderated by Professor Paul Rebo from the Center for Health Economics, University of York, who also happens to be director of the Tanzila program. Now, before I call on the first speaker, let me just mention here that as we go to the Q&A, on our platform here, we have a question and answer feature. So if any of the participants has a question that they would like to raise, we would encourage you to use the Q&A feature on our platform here. And when we go to the discussion and you would like to ask a question or make a comment, please use the raise hand feature that we have on the Zoom. So with that, let me now invite our first speaker, Susan Griffin, to give us the first talk. Susan, please.
Good afternoon, everyone. I will just get ready to share my screen with you. Okay, so hopefully you can all see my slides now. Thank you for that introduction. I'm going to give a talk about economic methods to inform intersectoral policies. So first of all, I'd just like to set the scene of what we are talking about here. The government manages collective resources, and in doing so, it supplies public goods, and its aim is to improve the welfare of the population. If you look on the graph on the page here, this indicates a utility possibilities frontier, for example. So ideally, the government would like to move us outwards and increase the welfare of the population, and may also be involved in redistribution to achieve a distribution of welfare that matches a social welfare function. The process by which the government manages and assigns and uses collective resources is usually involves dividing it into different public sectors. For example, we have health sector, agriculture sector, education sector. All of these contribute to the welfare of the population. When we're talking about an intersectoral policy, it's one that has costs and/or benefits that fall across multiple sectors. These may include policies that are delivered or resourced largely within one sector, but they have impacts on other sectors. And this includes the private sector and private actors. Alternatively, it might be one that, in order to implement it, requires collaboration across multiple sectors. We undertake evaluation to help inform some of these decisions, and the process of evaluation involves identifying the stakeholders. So these are the people that are affected by the policies options at hand. We need to identify these stakeholders to determine what do they value in terms of the policy outcomes, and also what costs do they bear, what role do they play in resourcing the policy, and how are the resources available to them impacted by different policy choices. Once you've identified the stakeholders, you can consult with them to identify outcomes that can be used to measure the things that they value and capture the impacts of the different policy options under evaluation. And then the evaluation evidences what the costs and the outcomes are that result from different policy choices. In order to make decisions between alternative courses of actions, when we're in the situation where we have a trade-off, where there isn't one policy that's identified that seems to have the lowest cost but the most beneficial outcomes, then we need to aggregate impacts to inform the policy choice and apply valuations to those trade-offs. We need to aggregate across the different individuals affected by the policies and across the different outcomes that matter to the various stakeholders involved. The methodological approaches that we apply to evaluation involve sets of value judgments. The fundamental principle underlying economic evaluation is to compare the outcomes against the opportunity costs so that we get the net impact of the different policies. There are a range of different frameworks for undertaking an evaluation. These include cost-benefit analysis, social return on investment, multi-criteria decision analysis, and cost-effectiveness analysis. When you look at applied studies that have estimated the value of policies that use these different approaches, they can differ in the sources of the value judgments that they entail, in the sources of the preferences they use for relative values across different outcomes, and they can differ in the way that they treat opportunity costs. Some work that we've been going through at the University of York has been looking at how to make the results of economic evaluation, how to make the process useful to informing decisions, especially in terms of outlining and distinguishing questions of fact from questions of value. So if we look at this in terms of the stages of evaluation, in terms of defining the scope of the impacts of the policy, this is where we identify the stakeholders and ask what outcomes are relevant to them. We may also ask if they value outcomes differently in different groups in the population, for example, for equity reasons. Stage 2 would be populating the impact inventory, so evidencing the different costs and consequences of the different policy options. And stage 3 is the aggregation stage. So how do we sum the different outcomes across individuals and across different dimensions? So there are some questions of facts that we can empirically measure. So which individuals in the population, which population groups are affected by our policies? What are the direct effects on the outcomes we've selected? And what are the opportunity costs? What are the outcomes that we could have achieved with alternative uses of the same resources involved in each policy? But there are also some questions of value. So what are the relevant outcomes, and how do we identify the stakeholders? And also, when we're aggregating the effects, what are the relative values of the different outcomes, and what are the relative values of individuals? So the framework we can propose is compatible with all of the different methods of economic evaluation, so cost-benefit analysis, social return on investment, for example. What it aims to do is to help highlight to the decision makers that are relying on the results of the analyses where questions of value have come into play, the sources of those values, and the importance or the sensitivity of the results to the values that are adopted. If we look at an example of an intersectoral policy, we could consider the social cash transfer project in Malawi. This is an unconditional cash transfer that targets ultra-poor and labour-constrained households, and it has aims to reduce poverty, to reduce hunger, and to increase school enrolment. And it's administered by ministries within the government of Malawi with support from donor funds. So in terms of an intersectoral policy, it's delivered with collaboration across sectors, so the Ministry of Gender, Ministry of Finance, and with support from international donors. It has impacts on other sectors. So in terms of school enrolments, this would be relevant for the Ministry of Education. In terms of agricultural productivity, this would be relevant to the remit of the Ministry of Agriculture. And of course, in terms of health outcomes, to the Ministry of Health. Each stakeholder involved or affected by this policy differs in their remit and may potentially assign different values to each outcome or different values to population groups. For example, the Ministry of Gender might have particular equity concerns related to the poorest groups in society and may value outcomes in those groups higher than outcomes in richer population groups. Bearing this in mind, we can define an impact matrix for the social cash transfer project, which is shown below. So we have the dimensions of outcomes that may be important to each stakeholder, and we select outcome measures that we can use to determine the impact of the policy on these different outcomes. So we might look at numbers of children enrolled in school for impacts on education outcomes. We might look at disability adjusted life years averted for health outcomes. In terms of net production, we might just measure that in monetary values. And in terms of poverty, we might look at cases of ultra poverty averted. Where we have equity concerns, we need to differentiate the outcomes in terms of the direct effects and the opportunity costs, which we can combine to calculate the net benefit in the different population groups according to the equity characteristics at hand. In this impact matrix, we've separated out the target population for the social cash transfer. So these are the very poor individuals from the group that are not eligible, so people who are not in such disadvantaged circumstances, and in terms of the fact we have an international donor as one of the stakeholders, the population outside Malawi, because the funds used to fund the cash transfer could be used in principle for policies that support other options. We can complete this impact matrix that we've defined for the cash transfer. And this is an example that we've developed just based on the immediate impacts. This uses a pilot study for the impacts of the cash transfer. It was a randomized study in 2 districts in Malawi. And this is just an example to show what it would look like if we inflated the results of that study and generalized it to more broadly to the policy. We can fill in the direct effects on education across the whole of Malawi, and that might result in 15,000 extra enrolments among recipient households of the cash transfer. However, there is an opportunity cost in terms of funds used to support the cash transfer that could have been used for other policies to support enrolments, and that those alternative uses may have provided enrolments to the tune of about 12 in recipients of the cash transfer and 268 in the population who are not recipients of the cash transfer. So there's an opportunity cost in terms of enrolments there, but the net impact on enrolments is positive. Similarly, for health, the cash transfer impacts on cases of diarrhea, cases of wasting, and other health events. And it actually results in 61,000 DALYs averted amongst recipients of the cash transfer. Because it averts cases of ill health, then it actually saves resources within the health sector. For example, with the essential health package, no longer has to reimburse treatments for cases of diarrhea avoided. So there's actually an opportunity gain in terms of DALI benefits for the population who don't receive the social cash transfer. So we see a net benefit here. However, if we have a donor that's just interested in health interventions, then there is the potential that investing those resources that they provide to the cash transfer directly to health interventions and across a range of different countries could produce more DALIs averted elsewhere. So there is an opportunity cost and a negative net benefit from the perspective of the population in other countries. And then you can see for the other dimensions that the impacts are positive in terms of net production and poverty as well. So in this case, if we look across the different remits of the different stakeholders, it seems that most of the domestic stakeholders would be aligned in their support of this policy, but the international donor may not be aligned in support of this policy if we characterize them as being solely interested in DALIs averted. This is not a completely accurate characterization because the donors involved may value some of the other impacts in this matrix, such as cases of ultra poverty averted. Producing information in this way allows us to look at how much a case of poverty averted would have to be worth to offset the opportunity cost in terms of DALIs averted. In addition, donors often apply equity weights to give priority to countries with low national income, and Malawi would likely be weighted quite highly in terms of this equity weight. So the opportunity cost in terms of health foregone in other countries wouldn't be weighted as highly as the health gains to the population within Malawi. The use of this impact matrix allows us to get away from this notion of a singular decision maker to inform with economic evaluation. So we don't provide information simply in terms of a single cost benefit ratio or a summary social return on investment value. It also allows us to think of the range of decisions the evaluations can help to inform. The value of the policy itself, so should we invest in it? It also helps to provide more information on what are the value judgments consistent with preferring a particular policy over others. It can be useful to inform discussions about the contribution from different stakeholders. So when different ministries are discussing their budget allocation, they can use this type of information to justify the amounts that they're requesting to support different policies. And it can also be used to consider compensations and transfers between sectors that would allow the benefit to be positive across all dimensions considered. So further work in this area at York is ongoing. I have Oliver Kawonga, who's one of the participants, I think he's listening today. He's conducting a PhD and he's looking at transport policy. This has a very high health burden attached to road traffic incidents, and he's focusing on how this health burden features in evaluations to prioritize and inform alternative transport policies. He's focusing on health impacts beyond road safety assessments and in principle could look at things like the building of a new road, for example. And he's also interested in reflecting the impact of road traffic incidents beyond simply their impact on health to look at household well-being as well. Ideally, what we want to do within the Tansi Lonze program is to respond to demand for evaluation of intersectoral policies and conduct applied evaluations using this impact matrix to provide information on intersectoral impacts and inform implementation and funding decisions. So if there is anyone here with any suggestions for areas that we could apply this work to, and anyone who would like to work with us in this area, please do let us know. Thank you for your attention.
Thank you very much, Susan, for that presentation. We'll move on to the next one. But let me just remind participants that if we have any questions, let's please use the Q&A handle on our platform. Otherwise, I think when we start the discussion, we can use the raise hand feature. Let me invite the second speaker, Aloysius Senyonjo, to give us the presentation on policy demands for intersectoral actions to meet health challenges in Uganda. Aloysius.
Good afternoon, colleagues. I'm going to request Soraya to help me project the presentation. Thank you. Yes, the discussion around intersectoral action and how we can harness health benefits from investments in non-health sectors is not new. And I've been pursuing a doctoral program on this agenda, partly arising from the work we have been doing from the SPEED project that was focusing on universal health coverage. We noted that increasingly many of the issues that we needed to pay attention to here in Uganda actually were because of the lack of attention to the benefits that can accrue from investing in other sectors like education, agriculture, transport. So we have also noticed that many times within the health sector, our focus is on increasing the budget to the health sector without paying attention to what we can actually realistically get from the national budgets. And so that is informing the discussion that I want to share with you, partly informed from public sector management and how government is organized to address cross-cutting issues. So in this presentation, I want to share with you a bit about Uganda, those of you who are not familiar, but also to understand what is motivating this discussion on intersectoral action away from the global level to maybe the national level. I want to share with you what the country is doing in respect to that agenda, picking an example of nutrition as a way to delve into that in practice, and then think about the way forward and implications that can inform the discussions. By general background, next, Uganda is a poor country of about 44 million people, depending on what statistics you read. But essentially, the poverty rate is at about 1 out of every 5 Ugandans are considered poor. That was before COVID. We don't know what has happened to that statistic. But also we realize that most of our people work informally and in a way that shapes the ability to engage in the economy, but also in productive lives, but also the needs that they may face when they interface with the health sector. We are very productive with about 5-6 children per woman and the population growing at 3% per year and a very young population. So next, in respect to our health sector, if we are looking at the health challenges that we are facing, so you realize that the indices for, yes. When you look at how maternal health care has been moving, the extreme left, you have antenatal care attendance. In the middle, you have birth witnessed within a health facility, and the one attended to by a service skilled provider. We see a positive trend over the last 6 UDHS assessments. In respect to the next, to the child health indicators, yes, we see a decline in infant mortality, child mortality, and under 5 mortality. But overall, we realize that we have a big burden of mothers and children who need health care. And then next, you have the issues of still maternal health. You look at unmet need for family planning, the prevalence of contraceptives, but also the ladies who are satisfied with modern methods of family planning increasing over time. So this was intended to give you a picture of how we are progressing as a sector, health sector, but also to position our discussion of where we need to pay attention to realize better health improvements. Kindly next. So this is an important discussion, and for me as a person who is from a medical background, we always have this discussion. What are the trade-offs that we need to make when we're investing, even within the health sector? So this quote says there's no point giving a child drugs to treat HIV if they can drink infected water and die of cholera. You've realized that even making a trade-off of how to invest in within the health sector gets down to nuanced discussions. And the tool that Professor Susan has shared in a way starts to also ask questions how it can be used inwards within the health sector. But for me, it is a question of us and how we deliberate on these decisions. I believe it becomes clearer that investing in water is not within the health sector's mandate, but it is mainly within the Ministry of Water and Sanitation here, Water and Environment here in Uganda. So there's need to be a discussion within these sectors on how to manage those investments. Going forward, next, we start to realize that we have the need of police. They have talked about Oliver's PhD, which is looking at road safety. In Uganda, we have had experiences of many cyclists ending up in the hospital because of inadequate enforcement of the road safety measures. So the police becomes an important investment area for health improvement. Next, within the global agenda, we start to see that health has been looked at as a core of the Sustainable Development Goals. All the development goals that we are pursuing to 2030 in a way converge around good health and well-being. So this discussion becomes critical. There is interdependence between sectors, as you can note in that number one. Health and education need each other, but also coordination of these different sectors become a critical aspect in pursuing that interdependence and mutual benefits. And the subsequent discussions are going to focus on how the country is looking at policy actions and support systems that are vital to have those deliberate discussions. So next, please. In Uganda, what we see is that there have been efforts that are shaping this land space for us to start to have policies that are required to work across sectors. In here, yes, next slide. In here, we see that there are formal coordination mechanisms, and this is coming from the work that I'm doing as part of my PhD, looking at what are the mechanisms within the government to facilitate this sectoral action. There are structures that are in place right from the cabinet, right from interministerial structures and committees. There are tools that have been set up. There are multi-sectoral plans. There are memoranda of understanding that are shared between different sectors. We also see processes such as the budget and planning being used to pursue multi-sectoral action. But also we note there are constraints, and the main issue is around mandates, and many times it's an issue of who is the role bearer and how do they play their role. There are concerns about under-budgeting for this process of coordinating and working across sectors, because itself as an action is sometimes taken for granted. There is lip service that is paid to the need, but the actual investments are not forthcoming. But also in our findings, we note that people are used to have corrupt tendencies, and working across sectors will require them to be more transparent about their resources and how they use them. Inwards, looking at health sector, we note that the Ministry of Health is also not well positioned to make other sectors come on board to address these cross-cutting issues that are advancing health objectives. And there are concerns that in the Ministry of Health has many departments, it has so many projects, it has so much money, and is in a way undermine their efforts even to be internally coordinated and coherent. So you find that it becomes less difficult for the health sector to reach out to the other sectors because itself is not prepared. We note that in our settings, we can't overlook the role of the donors. And in our setting here, they can play a positive, but also sometimes a negative role. There are many sectoral efforts that have been deliberately invested in by the donors around nutrition, around HIV. And these efforts in a way can easily fail to continue after this donor support ends. Next slide. So what we see generally is that there are many areas, thematic areas where we see multi-sectoral programs and plans being set up. I've talked about nutrition, I've talked about malaria, disaster preparedness and epidemic management around COVID, we have noticed a more or less of a natural experiment of multisectorality, different sectors working together. There have been talks, platforms like the One Health, which brings together health, environment, and agriculture, talk about the burdens of ill health that arise from interactions between animals, humans, and the environment. But also at this very point in time, this country has adopted the National Development Plan 3 that is focusing on programs. So government is reorganizing itself into programs of work. Instead of having budgets then going to, let's say, health, it goes to a program like human capital development that includes health, education, and the social sector. In a way, they are trying to align the planning and the budgeting process so the resources flow within these thought out programs. We see that, of course, plans and how they are resourced is going to be critical going forward, but also the evidence that informs the investment, but also the impacts and how this can be used to make deliberate efforts are going to be very critical. Next, please. So yes, you can run through these quickly. There are several documents, Soraya. Yes, so we have a national vision that is looking at the country's strategic direction for the next until 2040. And this is the way rallying the whole country and sectors around a common vision. We have a new plan that I've talked about, and these are the programs you see on the extreme right that where you see human capital development as a core program where health fits. But looking across, we are trying to see how do the different sectors have contributions in these different programs. And in a way, this is shaping up to be a very ripe moment to even see how the economic tools can be applied to further enhance that discussion. Next is that we have a national coordination policy. Sorry, we have a national coordination policy. Yes, that is under the Ministry of, that is under the Office of the Prime Minister as the lead of government business. And this in a way aligns all the government's interests around coordination and working across sectors. In other words, the policy and planning frameworks are supportive of this agenda. Quickly, next. So what we also see is that there has been an effort within the new plan to articulate the roles of the different sectors. The country has a new, as a roadmap for universal health coverage that looks at multi-sectoral programming and action as a very core area of work. So this is an illustration of what is being considered for water and sanitation to contribute to safe water access to individuals, but also to health facilities, issues of inspection of sources of water and the like. So we are looking at even identifying what could be the core roles that the different sectors have to play to in order to harness intersectoral action. Very quickly, yes, so I talked about nutrition, giving us some insights. We can move, kindly move to the next. Yes, yes, thank you. So within nutrition, what you see that government rallied all the core ministries to implement a national nutrition action plan. And in this plan, they have structures like the National Food and Nutrition Council. The Secretariat is under the Office of the Prime Minister. There are technical teams within different ministries and agencies to support that agenda. Next. Yes, you can move to the next. Yeah, what you see on the extreme right are the ministries that have been highlighted as core to supporting nutrition. Interestingly, you see ministries such as ICT, you see local government, you see trade and cooperatives, you see education and sports, because all these have unique contributions to support nutrition. Next. But what this graph shows that having multi-sectoral coordination and intersectoral action in itself is not enough. There are still other considerations to improve the statistics. As you can see from the midterm review of the previous sector development plan, they have been disparities within regions, others are remaining the same, although the gap is increasing between the UDHS of 2011 and the one of 2016. You still see that those in the bottom have remained more or less the same. Next. The same applies to the national distribution of starting as a measure of malnutrition. You see that the different color shades, where it is dark purple, that's where the heaviest burden is. But you see that even within the country, there are still challenges to address. So issues of targeting and how you can be able to pick out those that require affirmative action become critical even within a program of intersectoral action. And so as I move towards the conclusion, next slides. Yes, quickly. Yes, so what we have realized as core to this agenda, and we answering the discussion around policy demands for intersectoral action, is that we need to invest in the systems that are going to monitor, evaluate, and learning. The economic lens gives us one dimension, but they also need to look at data around impacts and the trends in resources, inputs themselves, financial outlays, as well as other non-financial resources. So we are looking at absence of a national system of information and data to support multisectorality. That's going to be a core area for concern. Also coordination within donor response, and also the coordination with the private sector is critical in this agenda. Next. The fiscal space that is available to fund health programs. And the core message here is that the discussion between investing in health and investing in non-health sectors is going to be a continued challenge for the health sector as we advocate for money to be increased to health, but also realizing that we need to pay attention to the money that goes to other sectors where we can get health benefits. Next. In Uganda, as we talk about intersectoral action, health challenges, there are some structural issues that have to be paid attention to. And one of them is the population that we have. I have already mentioned we have a very young population. And in that way, that drives our health needs. The young population means that we are going to have many going into reproductive and productive age. So many giving birth to new children, and that expands the need for MCH services. So transforming that population is going to be very critical for us to address the hello. Next. Yes, there is this discussion around mainstreaming health in all policies and how health impacts can be deliberately considered when other departments, ministries, and sectors are formulating their policies. The main concern there is that it tends to lose the interdependence because it makes like health as a more a superior sector. But in other words, the discussion should be how do we mutually address the issues that are pertaining to each sector in a way that does not create a sense of encroachment, but also enforcement. And finally, as I conclude, there is a discussion around the last slide, please. Yes. So when we look at the policy consideration from all this discussion, I highlighted several things that remain core. One is the coordination for government to act as one. How can government be more coherent itself is critical. The issue of resource allocation and management and across sectors. It's going to be very important. Making decentralization work, because many of our programs, although they are well designed at the center, they have to be implemented through a decentralized structure. So the role of decentralization and how this intersectoral action percolates to the subnational level is going to be critical. Mutual accountability and the issues of power and who convenes and who is in charge of the other. That's why you see there is a tendency within the new program of work, the NDP3, to have the Office of the Prime Minister, which is a more superior ministry to coordinate other sectors. And then the other issue, next, the final one, are the issues around how government works with non-state players, private sector, the donors, and a mechanism like swap that were very actively pursued in the early 2000s become even more relevant as we try to harness all contributions even within the health sector. And finally, the issue of leadership and vision still remain, although sometimes very soft, but remain critical to the pursuit of this agenda. Thank you so much. That's my sharing for this afternoon.
Thank you very much, Aloysius, for that presentation. We'll move on, and I will now invite Stephen Banda. Like I said, Stephen is from the Zimbabwe Ministry of Health and Child Care, and he will give us a commentary from the perspective of a person sitting in the Ministry of Health. So, please. Are you there, Stephen?
I think we may have just lost Stephen
All right.
Due to connection. So maybe we could just move on to questions from the audience or any comments from the speakers. And then if Stephen comes back on the line, we can have him provide his commentary.
Yes, I think so. Let's proceed that way. And perhaps I should now invite Paul to moderate the Q&A. And when Stephen, if he happens to come, then we'll give him some time to give his commentary.
Thank you. Thank you, Edward. And thanks to Susan and Aloysius for the excellent presentations. I was just counting the number of attendees on the call, and I can see we have participants from both Ministries of Health and academic institutions, even in 8 of the 9 ECSA member states, and also guests and Burkina Faso. So there's a real wealth of experience on the call. And as I was just beginning, I can see Director Banda. Are you back with us?
It's true, Paul. I'm big with you.
Good, thank you. I wonder at this point, Director, if I can hand over to you for your comments, for your commentary.
Thank you very much, Prof. Paul, and also thanks very much to the 2 presenters. Unfortunately, I lost my connections, but most of the things I managed to get it from the 2 presenters. It's true from Susan. What Susan shared with us is exactly what takes place in most of our countries, especially in Africa, where internationally. Can you hear me?
Yes, we can hear you clearly. Thank you, Director.
Thank you. So I was saying, this is common in most African countries. For an example, when we get international partners coming into the country, in most cases, they do all sorts of evaluations. So in most cases, wherever they direct their resources, those resources are informed with what's on the ground because of evaluations that could have taken place. But domestically or nationally, in most cases, when we fund our programs, they are not much informed with these evaluations. A good example is our budgeting system. In most cases, when we bid for resources from Treasury, you would see that it's more on political grounds where a vocal minister or cabinet member for that particular ministry gets more resources. as compared to the needy sectors or needy ministries who are just quiet, and also failure to bring analysis that shows exactly where these resources can have more impact if are directed to. So it's quite important, Prof. Paul, to have these evaluations take place and inform our decisions or inform policies, rather than just directing resources because of other factors beside studies that have been done, the analysis or evaluation that could have taken place. And also taking into account what my brother in Uganda have said, is true. In most cases, sectors or ministries where they interlink in terms of their contributions towards health and well-being of the nation, on the ground, when it comes to lobbying of resources, it's not like that. From the planning stage, the planning is actually not informed by what is actually taking place in each ministry. By that I mean, if you look at the way how we manage our information systems, is purely on, I mean, it's based on silos, where what Minister of Health is collecting and what Minister of Labor and Social Welfare is collecting, there are two different.
Hi, Stephen. Sorry, are we struggling to hear you? I'm not sure if you're still with us. It's clearly a challenge with technology here. It's a real shame. It's fascinating to hear the insights from a director of the director of planning in Zimbabwe. I can still see your name is on the line, Stephen. If you, unfortunately, we can't hear anything. See if your sound improves in a moment. If not, we can move on to the Q&A and come back to you. It still seems unfortunate there is a problem with the sound. So let's move to the open Q&A, and I think first of all I saw to highlight either it would be nice to hear people speak on the call if you're willing. So you have two options on the Q&A. One is under the participants bar, you should see a raised hand feature.
Hello, Paul.
Stephen, hi, that's great. Sorry, I can hear you again. I'll hand back to you to continue the comment.
Okay, sorry, like I've just apologized. I'm in a remote part of the country where we are doing consultations with the stakeholders. We are in the process of coming up with the national health sector plan for 2021-2025. Nevertheless, so I was commenting on Uganda to say it's a good example of what most countries do, especially in Zimbabwe. We've got good documents, good planning documents, which, if you read them, there is coordination on them. But when it comes to the evaluation or the way how financing is being done in those specific sectors, is a different thing. And then when you evaluate programs on the ground, you can actually see that the impact that comes out of that is not related to the resources that are pumped into these different sectors, simply because of, one, uncoordinated planning that takes place. Two, don't share information which is strategic. Each and every sector has got its own silo type of managing its own information, of which we think if we can have consolidated system that speaks to most of key programs and managed centrally For example, if we've got statistical offices or organizations which are either housed within government or outside government, but having the mandate of government to manage the information, it becomes easier. But then, in short, in most cases, our decisions are not based on evaluations, which Susan alluded to. We are simply based on papers that we produce specifically for our own sectors, which are different from other sectors. Hence, the resources are wasted and impacts we don't achieve the intended goals as a nation or as a country. So in short, for the two presentations are so important, and they speak to one thing of coordination. If coordination is not there, then we lose everything, up to the financing, the management of this program, the evaluation of these programs. It's a waste of everything. So I just hope that with this program that we are now having through yourself, the University of York and Tanzania, it should be able to actually put emphasis on the issue of coordination when it comes to evaluations in different programs, and at the same time, the resource allocation themselves, so that sectors speak to each other, and we have single evaluations that are done once in a blue moon to just have, to measure impacts in most of these programs. I think, in a nutshell, that's what I got from the two presenters, and at the same time, the experience that we have in Zimbabwe, to say we've got many documents which are good, but when it comes to implementation, they don't normally bring out what they are intended to do in terms of program and also impacts that are intended to be achieved by those programs. Over to you, Prof. Thank you.
Thank you so much, Director. And it's really fascinating insights, and it's really telling how the experiences which Dr. Aloysius and Professor Griffin have outlined, both conceptually and in terms of practice in Uganda, also align with your experience in Zimbabwe. And thank you particularly for highlighting the challenges in relation to coordination. So I guess a question for all of us is how we can do better for coordination to ensure that thorough evaluations in the way as was presented meet the needs and can be informative and used for policy. So I mentioned that we have two options for Q&A. One is on the participants bar. If you click on the participants button at the bottom, you should see a raised hand feature. So you can ask questions through that. Plus also there is the Q&A bar if you prefer to type. I encourage people to speak, and let's try to have some discussion across and joint learning across all of the teams now. With the emphasis that Director Banda placed upon coordination, there's a question in the Q&A bar from Dr. Juliet Nabionga from WHO Africa, which I think is pertinent. I wonder, Dr. Juliet, whether I may pass to you to ask this question to the speakers, or if not, I could read it out. But,
yes, thank you, Paul. Thank you so much, colleagues who have presented. I have two questions, one to Aloysius. Do you think, because I think the move towards program budgeting is a good one, and do you see that this evidence as presented by the first speaker can really be taken up to inform such discussions? And then also, again, another question to you, because when you move into program-based budgeting, you need to have planned along the same lines. But if you have standalone plans that are developed by ministries with overlaps, with duplications, so as you move through towards program-based budgeting, what efforts are being made to ensure that planning also follows the same thinking and the same trend, such that allocation of resources is more aligned and the decisions are easier to make? Over.
Dr. Aloysius?
All right, thank you, Dr. Juliet. These are very pertinent questions. Let me start with the second one before I move to the first one. What we need to acknowledge that in the country, the planning function was centralized to the extent that there is a national planning authority that has the mandate, legal, to bring all sectors, ministries, departments, and agencies to plan around a coherent national strategic direction. To their credit, they have created a vision for the 30 years from 2010 to 2040. And then they have these medium-term national development plans. And the one I referred to that as adopted program-based budgeting is the third in that series. So whereas
Sorry, Aloysius, you seem to have gone on to mute. I don't know if you could unmute yourself. There seems to be a problem with muting. If you can possibly click the unmute button, I'll.
Sorry. Yes, sorry about that. I was saying that to budget cycles ago using the previous sector plans. Hello.
Hi, sorry, Aloysius, would you like to continue? We can hear you now.
I'm very sorry. I'm not in a very favorable place concerning connection, internet connection. But yes, so the planning has also moved along. We are yet to see the fruits of that process, but at least we can be cognizant of the fact that the planning has tried to align with the program-based budgeting. Regarding the first question of how the analysis that Prof. Susan shared and how it can be used to inform, I think the questions of still there is a need to break the barriers and the norms that would require even people to come together to see the value of that kind of analysis. We know that different ministries have different planning tools, and who is supposed to champion that cause remains, I think, a broad question. The academia and the programs like Tanzolans have a role to play that brokerage function, but also believe that working within the formal agencies of government that have mandates to bring sectors together would be a starting point. So some bit of advocacy would be required. There's real value in that analysis, but also you need to understand that my little understanding is that there is always a burden of so many tools and approaches. So how do we make this stand out of the many potential lenses to support decision making? The politics itself being a critical element we need to contend with. Thank you.
Absolutely, thank you, Aloysius. Looking for questions from others either through the Q&A or through a raised hand. I saw a raised hand from Paul Otung. I wonder if, Paul, if you're willing to ask your question.
Yeah.
So maybe if you just...
yeah, I was...
We can hear you now.
Can you hear me?
Yes, we can, yes.
Yes, good. Now, one of the mechanisms, I'm calling from Kenya, Nairobi, Kenya, and having the experience of having participated in the government budgeting process, Kenya moved into program-based budgeting. So essentially, you have programs within the individual sectors, but ideally you find that these are programs still within ministries, even though the coordination mechanism is at the sectoral level. So you have ministries that are classified together. For example, agriculture and rural development having a group of ministries and resources are bid within that framework of the sector. I was just wondering whether that kind of mechanism would introduce certain efficiencies in resource bidding and sharing in Uganda. Over and back to you, Chair.
Thank you, Paul, for your question. So, Aloysius, could you perhaps comment on that again? Are there similarities in approach on our organisational structure between Kenya and Uganda?
I think in principle, the two approaches have the same mechanics, that you bring sectors that have common or closely related business together to formulate a program. I've mentioned the human capital development program that is mainly looking at health, education, and social security. In paper, I think, and on paper and in theory, you realize that yes, this should be able to bring efficiencies in that people are focusing on outcomes, and they have to develop projects that align to the program, and in a way there are mechanisms for mutual accountability across closely linked areas of work. What is not yet clear is how even these these programs really are going to be rolled out, because there's still going to be a negotiation. I'm aware of discussions even within the the Office of the Prime Minister, who now to contribute and play better their role as the chief coordinator of government. So the programs have been designed on paper, but actual implementation is not yet started, and that will have a big bearing in if those efficiencies will be realized. But there's potential there, and learning from Kenya, I think, would be very critical in that process.
Thank you both. You highlighted again, as you did in your presentation, Aloysius, that the Prime Minister's office in Uganda has a particular role in supporting multi-sectoral collaboration and is kind of the highest office of the line ministries. I wonder, I'd be very interested to hear from participants from other countries whether there's an office, the Prime Minister's office, or similar presidential or cabinet office, which whether in other countries such offices play similar roles in enabling multi-sectoral coordination. So please, if anybody, we have participants from Malawi, from Eswatini, from most of the ECSA region, and also from West Africa, from Ghana and Burkina Faso. I'd be really interested to hear from others about approaches in their settings on the call. So maybe he's a friend, he's a good friend, so I know he won't mind me doing this, but I wonder if I could ask Dr. Nkoma in Malawi, for instance, how the coordination mechanisms in Malawi look.
Yes, thanks, Paul. I would say, yeah, so generally, I think the office of the president and cabinet and the chief secretary does multi-sectoral coordination, and that function is executed through the PS's committee. So, for example, within a sector, so health, although there's so there'll be a PS's committee, maybe that focuses on health and say social welfare, social development. So then the grouping of the PSs would then be responsible for the decisions that affect multi-sectoral decisions that affect. So, for example, in nutrition, so health and nutrition would then be connected under a cluster for the PS's committee responsible for that cluster. So, if Ministry of Health has a policy that affects other sectors, then the PS for Health then pushes a motion into that committee. Generally, that committee is then also linked to a cabinet committee or the ministers. So that also be my sector. So, for example, the health policy would be discussed by a cluster of PSs first, and then that when it's endorsed at the PS's level, then the PS for Health takes it to the cabinet committee. So something like that. So I'm not sure to what extent the office of the vice president independent provides that, but I think what I know is that the office of the vice president then functions in a dedicated authority in that respect, in the sense that it will act if things have been moved from the president's office, or if the president has delegated, the way it's structured that the president and the vice are almost functioning in the president's office, except that the vice president as a ministry or a structure that we can identify as office where it executes. But generally, the system still uses the cabinet's office of the president cabinet as a coordination point for work that's much sectoral in nature. Yeah, sure.
Thank you. Dr. Juliet, I can see your hand up again.
Yes, I think I have a comment to make, but also, Paul, taking it from the question you asked. And I think for us, it will be good to follow the Uganda example. Maybe we can get a formula that works. The challenge we've had within the WHO African region regarding multi-sector collaboration is, of course, who coordinates, and Aloja has touched on that, but also what I've observed is that it's easier to coordinate around a narrow scope of work. And that's why the approaches that have been successful have been narrow in scope, like coordinating around nutrition, because maybe you're dealing with fewer ministries, but also you're looking at a smaller scope of work. Around emergency response, time-bound exercises. So, but getting a whole sector portfolio into a multi-sectoral program is really challenging. So maybe the good side for Uganda is that it's been backed up by also the budget processes. So it's no longer coordination that is loose, that is for the willing partners. Backing it up with resources maybe can be beneficial, but also you need to appreciate that coordination is real work. And maybe we need to discuss that when you say coordination, what is it that you really mean and what is expected of the coordinator, in that case, the Prime Minister's office. Is it to coordinate the planning process? Is it to coordinate some joint pieces of work like procurement? Is it to coordinate reporting? Is it? So it also has to be refined because it's too much work. And I don't know how resourced the Prime Minister's office is in Uganda. And the reason I raise this is that we don't pay attention to some of those specifics, and actually it fails the whole process. Over.
Thank you, Julia. Excellent comment as always. And I also noted in Dr. Aloysius's presentation that he highlighted the importance for resourcing efforts to coordinate, but I think it's very telling that you say the successes tend to be where the problem has been defined very clearly and is a particular and limited scope, such as in nutrition. So we're getting towards the end of our time. I think we allocated an hour and a quarter for this webinar. It feels this is the first time this group has got together as a whole, and there'll be a series of such webinars. You'll receive information on the full series soon. So we hope that as we continue speaking together, we'll continue benefiting from joint learning and have discussions across, drawing upon all of our expertise. It's been notable how the challenges faced in Uganda do bear a lot of similarities to Malawi, to Zimbabwe, and as Dr. Juliet highlights, across the whole region. Before I hand over to Director Kataika again to close out, I want to reflect upon one thing. It does seem to be an area where there's lots of potential for greater evaluation and greater links across research and policy. As Dr. Susan highlighted Professor Susan highlighted in her talk, if any of this group has an interest in initiating a research project, do please communicate to all of us. And I think there's all of the possibilities that we can take research efforts further and push new bounds with that. There is one call at the moment, actually, the Health Systems Research Initiative, HRII, which seeks leads particularly in Africa and the global south. Maybe that's an opportunity that you can, those of us on the call can look at. But I hope that these continued discussions around intersectoral resource allocation can continue crossing both the research and policy lines. So I just want to check. I don't see any further comments. If anyone would like to ask any final questions or comments, here's your chance. If not, I will hand over to Director Kataika to close the meeting.
Yeah, thank you very much, Paul. I think what remains for me is to thank all the participants for their attendance and for your participation. I see that it was now beginning to get interesting, and the 1 hour that we had allocated seems to be a bit too little. And I believe that we are off to a very good start. As Paul has said, this is the first in a series of webinars, and we intend to organize a few more in the coming weeks. And we look forward to seeing you all on those webinars. We'll be looking at topics that we believe are of interest to our region, but also beyond, knowing that we also have participants that are coming from other regions. And like I said, the intention here is to just share knowledge, share experiences and ideas, which we have already seen here. We are beginning to see what the experience of Uganda, and we believe that the other countries can also learn from what's happening in Uganda. And of course, the technical presentation that we had from the University of York. Let me also thank the presenters, Susan and Aloysius. Stephen, I think a special thank you to you. I know you are out in the, maybe with technology challenges, but you still managed, you still persisted to give your commentary to this. Thank you very much for that. So once again, thank you to you all, and we look forward to seeing you again in the webinars that we'll be organizing in the near future. We will communicate to you what the next topic will be, and hope to see you soon again. So I will close the webinar at that point. Thank you very much.